Hi.
My name is Stephanie.
Hi, Stephanie.
I'll be
Nice
your nurse today.
to meet you.
I'm going to do a physical assessment on you, okay?
Okay.
Alright, you look very clean and very distinguished today.
Well, thank you.
You're welcome. Alright, rinse your hands real quick. Alright, turn them over. Alright, your nails look good. You got some calluses and looks like a blood blister.
Yeah, I work out a lot, so.
Did you work out today?
I did, actually.
Good. Alright, well you look well nourished. Your skin looks very tan. Your clothing is very appropriate for your clothing.
Cool.
You look very happy.
Thank you.
You're welcome. You have very broad effect. Speech is clear. You can hear me very well.
Yeah.
Awesome. You have very good posture, which is wonderful. You don't have to do that.
Exaggerate.
Yeah. No physiological deformities, no involuntary movement. Okay, so I'm going to start with a head, face, and eye exam. Is that alright?
Fine by me.
Lean your head down for me. Alright, what I'm looking for is any lesions, light, bumps, bruises. Look like that. Hair symmetrical. Looking for a temporal artery. No, wonderful. Can you open and close your mouth for me? Alright, smooth TMJ. We'll check some lymph nodes. That swollen one back there behind your right ear. Have you had any, have you been sick lately, or?
Not that I can remember. Allergies or seasonal allergies.
Right for me?
Right.
Alright, do that. Okay, keep forward. Alright, that's the only lymph node that's behind the right ear that, I can see it.
Okay.
That's a good sign. And just your maxillary, your frontal sinus, so if you feel any pain.
No.
Oh,
Nothing.
good. Alrighty. So what I'm going to do next, check your eyes. It's going to be bright light.
Okay.
Okay. Get off the stick.
Right.
Optic disc is yellow and kind of orange color. The retina is red color. The macula, I see a little bit of a little blind, huh?
Yeah.
So a little dark spot. That's a good sign. And I see some arteries.
Okay, cool.
Alright, I'm gonna shine a light in your eye again, okay?
Okay.
Alright, corneal reflex. Light reflex is symmetrical. I'm gonna check your cardinal vision of the gaze, or gaze position.
Alright. Take your
Alright.
time.
Follow this one. Alright. All those look wonderful. We're checking cranial nerves 3, 4, and 6. Now we're going to do a cover test. Stand in front of me, nice sadness. Alright. Good sign.
Good. I don't know any of that.
Alright, I'm going to have you look out for me and I'll keep your finger up, okay? Normal. Your sclera are all white. Your irises are green. Is that your normal color?
That is normal.
Alrighty, and pupils are up. Now I'm going to check your pupil spot.
Okay.
Straight ahead for me at my ears. Alright. Look constrict. Have you face the wall? Not the side. Not the wall. Okay. All right. Pupils are equal and reactive to light and round, and they're also accommodated. Let's see. Now, how I would check your vision is I would use a Snellen chart. What a Snellen chart is the letters or numbers that go from big to small,
Oh, okay. Gotcha.
and different rows, and you have to use the smallest row, like 20 feet.
Yep.
Yeah, okay. Alrighty. Now I'm gonna check your ears. Alright. And if you can look up for me, I'm gonna check your maxillary and your frontal sinuses. Let me know if this hurts.
Nope.
Awesome. Alright, now I'm going to check your 6 cardinal points of gaze. If you can just follow my pen for me.
Okay.
Just your eyes. Alright. You passed the eye exam. I'm going to have you cover this up. A nystagmus. No nystagmus. Good.
Good.
Alright. Now how I would have you do the Snellen chart is read a chart on the wall. It has letters or numbers going in descending size on each row, and have you read the smallest stitch you can up 20 feet away from it.
Okay.
Alrighty? Alright, now right now we're going to check your ears. Alrighty. You have a nice pearly white tympanic membrane, just a little bit of earwax. Awesome. Both of them are pearly white. I'm going to switch this piece out and look up your nose. Okay, mucosa is pink and moist. Sorry about that. This one's kind of, that turbinate's a bit swollen and a little bit of bloody discharge. Are you having allergies right now? Or? Oh, I'm sorry.
I blow my nose pretty hard too.
Try not to blow your nose too hard. It'll probably cause a bloody nose.
Yeah.
Alrighty. Now, if I can have you say "ah" for me. Alrighty. Your mucosa is pink and moist, and your tongue's kind of moist, pink, and rough. But can you lift up your tongue? Alright, I see veins there, which is a good sign. You have all your teeth. I'm gonna gag you real quick.
Ow.
At least you have a gag reflex. That's a good sign.
Okay.
You don't have any tonsils.
Nope.
You had a tonsillectomy at age
10.
10?
Yep.
Okay. Alright. And your uvula is not bifurcated, which is a good sign.
Okay.
Your soft palate and your uvula go up when you say "ah," which is a good sign. Those are also pink.
Alright.
Alrighty. Alright, stick out your tongue for me. Alright, tongue is midline, so no issues there. I'm going to have you close one ear and have you repeat what I say.
Apples. What was that? Say that again. Starfish.
There we go. Alrighty, no. Have you ever had hearing problems?
No.
Okay, good. Alrighty. Now, what I'm going to do is I'm going to check your neck. Alright. No masses. Any tenderness in your neck? No? Okay, I'm going to have you turn to your left for me. Alright, to your right. Alright, now do that on your own. To your left and to your right. And then up and down. And around in a circle. Alrighty. No problems with range of motion there. Are you having any tenderness or pain with that?
Mm-mm.
Good signs. He has a symmetrical neck. Let me check your carotid. +2 on that side. Not to include +2 on that side. Both sides at the same time. Don't want you to passing out on me. All right, turn around for me. Let me check your thyroid and your trachea. All right. Your trachea is midline. Thyroid is also midline. That's a good sign. If I can't feel it, it's good. If I did, then it'd be enlarged and you might have some thyroid issues, but you don't.
Okay.
All right, now I'm gonna check your peripheral vision. You tell me when you see these.
Now. Right side. Left side.
Alrighty, good job. Turn around for me. Now I'm gonna move these out of the way. Now you lay down for me and check your lung and your heart sounds. And here I'm checking also for any jugular vein distension. So I'm going to use a ruler real quick and a flat edge. Find the highest point that I can see is jugular pulsating. Alright, 1.5. That sounds 1.5 centimeters is pretty good to me.
Okay.
Alrighty. I need you to lift your shirt up for me. Now, he has a symmetrical chest, even hair distribution. What I'm going to do is I'm going to have you say 99.
99. 99. 99. 99.
Alrighty. I felt a little bit of tactile firmness, but that's normal.
Okay.
If I felt a whole bunch, then it probably mean you have some consolidation in your chest.
Okay.
I'm going to palpate for any masses. No masses. Any tenderness?
Mm-hmm.
Good. Alright, now I'm going to listen to your lungs and your heart. And take a deep breath in through your mouth for me, okay? Now. Alright, while I'm here, I'm going to listen to your heart
Okay.
at the aortic valve. Pulmonic. Tricuspid. And mitral. And here I'm going to listen for about a minute so I can hear your apical pulse and count it, okay?
Okay.
It sounds regular S1, S2 so far. Alright, 61. And I'm still going to listen to it, sorry. I got to listen to it with the bell on my stethoscope. Hear any murmurs? Aortic, pulmonic. Tricuspid. Mitral. Now I don't hear any murmurs or any bruise or anything like that, which is a good sign. Now I'm going to have you sit up for me. Alright, and I have to lift the back of your shirt so that I can listen to your lungs through the back. And I'm going to have you whisper 1, 2, 3 after you take a deep breath in and out, okay?
Okay.
Okay, go ahead. which is a good sign. If I did, then you probably have some consolidation in your lungs. I'm gonna palpate, or percuss, not palpate, your lung borders, okay?
Okay.
Take a deep breath in for me. Alright, and take it and let it all out and hold it out, okay? Is that all out? Alright, and that's about, thank you very much. Seven centimeters. All right. Now what I'm going to do, I'm going to have you lay down again so I can listen to your abdomen, so I can check for your liver and your spleen borders.
Okay.
All right. All right, I'm going to lift up your shirt. All right, and his abdomen looks flat and symmetrical and hair is evenly distributed. Have you had any problems with bowel or bladder lately?
No.
Okay, good sign. Alrighty. I'm going to listen to it first, okay? And usually here you listen about 30 seconds to 5 minutes for any gurgling or tinkling sounds. And he has bowel sounds in all 4 quadrants that are normal, active. They're not too much or too little, and if they were too much and too little, then he'd either have, for too little, he would have a slow bowel or a paralytic bowel. And if he had too much, then he'd probably would just be hungry.
Mm-hmm.
All right, now what I'm going to do is I'm going to listen for your aorta here too. All right, +2. Alrighty, and no sounds of bruise or anything like that. Now right now I'm going to palpate very lightly. My hands are warmed up so that he's used to my touch. Now you let me know if this hurts or you have any tenderness, okay?
Okay.
Anything like that?
Mm-mm.
Right now I'm going to palpate really deep, okay? It's going to hurt a little. Any pain there?
No.
Awesome. Now what I'm going to do is I'm going to palpate for your liver and your spleen. Now if I feel your liver, then that's normal, but if it's farther than just my fingertips, it might be enlarged. And if I feel your spleen at all, it'll probably be enlarged. So I just wanted to give you a heads up. Take a deep breath in for me. And out. Okay, and in. And out. Right now I'm going to do the hook technique. Take a deep breath in. And out. Alright, I just lightly felt your liver, and that's a good thing. It just bumped my fingertips, so neither your liver nor spleen are enlarged.
Good.
Alright, now let me come over here. Alrighty. Check your liver border, okay? I'm listening for a really dull sound in between in intercostal spaces. Right, and there's the lung border. And there's the abdomen border. So it was about dull in between here and here. I'm going to measure that real quick. It's about 10 centimeters. And that's normal. Normal is in between 6 and 12. Alright, I'm going to have you sit up for a minute, Cole. Swing over to the side. Now you relax your arms out so I can feel your pulses. +2 on brachial. +2, and they're both strong and equal on radial as well. All right. I'm going to have you grip my hands as hard as you can. Awesome. Equal strength in both. And then you raise your arms for me. Raise them up. All right, put them down. Now flex your arm real quick. And now pull against my arm. Push. And pull. And push. All right, now on your hands, you need to push against me. Okay, and now pull against me. Okay, and now do this and push as hard as you can. Does that hurt anywhere at all? Good. Now you can stop now. That was just a check for carpal tunnel. So if that didn't hurt, then that's a good sign. Alrighty. Let me get my equipment. Alrighty. Straighten your hands against my shoulders. Alright, bring them out. And in. Okay. Good. I'm going to have you lay down real quick. Good strength in all of those. Now I'm going to have you bend your knee. Alright, and this one slowly. Alrighty. Now if you can, there we go. Alright, you have even hair distribution against your leg, over all your lower extremities. You have a little bit of scrapes on the inside of your knees. Is that from working out?
Yes.
Okay. Alright, now I'm going to have you bend your leg and up towards your chest. And out straight. And down. And up towards your chest again. And out straight. And down. Alrighty, and wiggle your toes and ankles for me. Alrighty, now I'm going to have you try and move your leg up against my hand. Alright, and bend your knee and move it down. Alright, bend your leg up and move it down. Alright, popliteal pulses are usually non-palpable, but this time they're just a little bit, so it's +1. I'm checking dorsalis pes pulses. +2. And I'm checking posterior tibial. And those are +2. Alright, I'm going to have you press your feet up against my hands and pull against them. Alrighty, good job with that. I'm going to have you bend your knees up for me. And with this hip, I'm going to have you rotate it outward and then inward to your other leg. Alright, and now the other hip. Outward and inward. Alright, good hip. He has good range of motion in his hip, knees, ankles, and feet. Now we are going to check the musculoskeletal. So Cole, I'm going to have you stand up for me for a minute. It's hard to put those phones down, isn't it?
Yes.
Alright, I'm going to have you do a deep knee bend and come right back up. Alrighty. And now what I'm going to have you do is bend over and touch your toes so I can check your spine for any scoliosis or... Alright. He has no kyphosis. He has a straight line for his spine, so no scoliosis. You can stand back up. Alrighty. And what I'm going to have you do is keep your feet close together and put your arms out and close your eyes. About a minute. And here I'm checking just for maybe a gentle swaying, which is normal. He can keep his balance. Now if he was swaying too much or couldn't keep his balance, that might indicate any intoxication or an inner ear problem. Alright, you're all good. Now what I'm also going to have you do is walk from the wall. So can you stand by the wall real quick? Alright, and then to the other wall. And back. Alright, and he has no abnormalities in gait. It's steady and smooth. Next, we're going to check for his neurological problem, or not problems, but neurological status. I'm going to have you lay down. I'm going to start something against your foot. It's called a Babinski reflex. Might tickle a little bit. Alright, and his toes did not flare out. They're going inward. His foot is turning inward, which is a good sign. We're also going to check any coordination of his skills, so calling it how you sit on the edge of the bed. And I'm going to have you pat your palms against your thighs and then turn them over and pat the back of your hand. And do that as fast as you can, back and forth. Alright, that's wonderful. And now next I'm going to have you touch your nose and then touch my finger and back to your nose and back to my finger. Go ahead. Alright. Well, I'm glad you followed that. Clear as mud, right?
Good.
Okay, and now what we're going to do is we're going to do a heel to shin, down your shin. So take your left heel and run it down your right shin. Okay, and that was straight. And your right heel down your left shin. And that one was straight in midline, no deviation, no problems understanding that direction. So that's wonderful. Now what we're going to do is check his sense of sensation and any reflexes that he has. Alright, I'm going to check your radial reflex. So just bend your arm real quick and relax for me. Alright. Move a little bit. Now what I'm going to have you do is hold your arms out like this and pull as hard as you can. Alright, there's a +2 tendon reflex. Pull as hard as you can. Alright, +2 reflexes. Alright, last one I'm going to do is your Achilles reflex. And keep doing that, pulling as hard as you can, okay? Alright, there's a reflex there. There's a +2 reflex there. Wonderful. Reflexes are all intact. Last thing we're going to do is your neurological exam for sensation. So I'm going to have you close your eyes for this part. Now tell me where I'm touching you. And where was that?
On my left arm.
Okay.
Right hand.
Okay.
Right here. My foot.
All right.
Right here on my leg. Right here on my cheek.
Okay. All right. Now what I'm going to do now is if you can tell me if this is soft or sharp. All right.
Okay. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp. Do that again. It felt soft.
Correct.
Ooh, sharp. Soft. Sharp. Soft. 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 Sharp. Sharp.
All right. Now, do you have any questions for me?
I don't have any questions.
Okay. Do you have any suggestions or any input towards your diet or exercise routine, any physical,
Nothing.
anything else you want me to check?
No.
Alrighty. Well, this is the end of the exam.
Okay.
Thank you very much for your time,
Well, thank you.
and I'll see you in the future.